Do you enjoy data futurology and the unique take that we have on leadership in data science? If so, please consider sponsoring us. We're currently looking for individuals and organizations to help us continue to create this content for the community. If you're an individual, please head to our Patreon page. That's patreon.com/datafuturology, and you'll get some special perks, special access through that page. If you're an organization and you would like to get involved and help data futurology, please get in touch with me, either through LinkedIn, through the website, or via email. We'd love to hear from you so we can continue this mission of helping people become better leaders in the data science space. Thanks for your support. Today we speak with Chris Boone, who is the Vice President and Global Head of Health Economics and Outcomes Research at AbbVie. He's also an adjunct professor at the New York University's Graduate School of Public Service. He's an active board member of several influential organizations. He's had a few startups in the past, and most recently he served as the Vice President and Head of Global Medical Epidemiology and Big Data Analysis at Pfizer. He is a fantastic leader. He's a visionary and innovator. He leads with his heart and essentially not with his brain, and uses his intellect to bring people up. I thoroughly enjoyed the conversation with him. I hope you will do as well. Let me know what you think. Here's a conversation with Chris. If you want to get more value from your data analytics investment, I highly recommend you speak with Rubix. That's Rubix with an X at the end. I've done a lot of work with them. They're excellent at what they do, and they're a lot of fun to work with as well. Rubix are a fully Australian-owned data analytics technology services company. They work with top ASX-listed companies. They are dedicated to being Australia's leading data company. That's all they do. They love doing it. The experts at Rubix apply their extensive data capability and rapid analytics framework to help you get the value you need from your data within a couple of weeks. After that, the sky's the limit. I've been impressed at how fast they are at delivery. Unlike other consulting companies, Rubix is a true partner. They are data specialists. They always send in their A-team, or as they like to call it, the data Avengers. For data strategy all the way through to delivery, give them a call, ask for Dylan. You'll have a fantastic conversation. You'll walk away smarter and have had a few laughs as well. And also check out the website, rubix.com.au, and for the contact form, go to rubix.com.au/contact. Hi, this is Felipe. Today I'm speaking with Mr. Chris Boone, Dr. Chris Boone, actually. Chris, thank you so much for joining the show. How are you doing today?
I'm great. I cannot complain. In spite of this COVID pandemic that we're all suffering through, I'm doing well in spite of that. So.
That is great to hear. And I wanted to ask you at the beginning for the people that may not know you yet, can you give us a bit of your origin story and how was it that you got pulled into the world of data and then obviously into health informatics, and we can take it from there. But how was it that data first intrigued you and enticed you to get into the world?
It's funny because I think that everybody would say I wasn't pulled, I was called. It was a calling. Some like spiritual moment that we all have when we come into the world of data. I think it's interesting, but I actually, I was, it's actually a more interesting question to ask about the world of health data, but I'll start with data just broadly. I actually was, my undergraduate degree was in information systems, and so I was in the world of data and data structures pretty much that entire time, right? I mean, that's what the premise of that particular college major is around data systems and data structures. And so, but I knew that, over the course of doing several internships in my undergraduate career, that I didn't really care for industries where I didn't feel like I was helping people in a meaningful way. And there was a moment when I remember when I had an advisor who I don't even speak to this day, but I should credit her with all of my success because she's the one that redirected me to healthcare. And I remember when I was having a conversation that, most of my internships at that point had been in the energy and oil and gas industries. And I went to her and I said, I'm just not feeling it, and she goes, well, what's the problem? I said, well, it's just not meaningful to me. I really just want to help people. And at this time, this was in the year 2000. And she goes, well, have you thought about healthcare? And I was like, healthcare? And who wants to do that? I don't want to be a doctor. I don't want to be a nurse. I don't want to do anything like that. And she goes, no, but you can do administration. And I was like, what's an administrator? I never even connected the idea of a hospital and hospital having hospital administrators. And so, I started to do some really thorough research on it. And I was convinced that that was my purpose and that I was going to go off and I was going to be a CEO of a hospital that served underserved populations, right? And so if you look at my career trajectory, you'll see someone who graduated, start working in hospitals, got a master's in healthcare administration, became a fellow of the American College of Healthcare Executives. I was well on my way. I was focused.
Yeah.
But I think there was a pivotal moment when my mother, who actually had she had several chronic conditions that she deals with, but she had a stroke, and it was a very young age when she had it. And we were literally, like, when she started to exhibit symptoms of it, she went to one facility, one hospital. They essentially misdiagnosed her in many respects. Then, and little did we know, so she had this blood clot that just traveled up to her brain. She had a stroke. She ended up at another facility. Now, none of us really even knew what all of her medical conditions and all the medications she was on. So it was my first real direct experience with the lack of information exchange.
Yes.
Keep in mind, I was in my management information systems major, right? Mm-hmm. So to me, it dawned on me that my greatest impact to the world could really be not in being in some, no offense to hospital administrators, but political role running a hospital, but more or less in how could I use digital technologies and data to really improve care for all patients? And so at that point, I made a pivot. And I started to focus all of my efforts and energies into kind of innovative approaches to using data, public policy that affected our ability to use data, hence my doctoral studies in public affairs and public policy. I started to get on, committees and all sorts of things, everything centered on data, but it's centered on healthcare data. And now we're at a place now, it's interesting, and I know you can stop me if you have other questions, but now we're at this place now where we're incorporating all types of data, because essentially in my eyes, all data is healthcare data, because it's all human data is healthcare data. And so it was really cool now that we're at this time where we are exploring what the maximum utility of all these different data types are for healthcare. But anyway, so that's how I ended up where we are.
What are some of the barriers for organizations? I want to say organizations in particular. What are some of the barriers for organizations to be able to do clinical research? Because it's something that, as you said, like the systems are not geared for it. I think sometimes people are not thinking that it is possible. What are some of the things some of the barriers that you've seen, and then maybe some of the benefits of doing that level of research as an organization?
It's I think so. You're right. You're thinking about it right. As far as like the cultural barriers are always, is what I would tell people. It's not the technical or technology that's the biggest barrier to really making this work, because I do believe if you devote the right amount of monetary resources and human resources, you can address many of these issues. But I think the problem that we have is we're still in a society where there's fear of the unknown. I also think that in some cases the system is set up to benefit folks from having that level of fragmentation, or even we'll say lack of high data quality, because then it incentivizes them to then start a company that comes in and cleans up your data, or so it's almost like it's more economic than the cultural issues. I still think within organizations, though, there's that fear of the unknown. But I think when you have any type of innovative approach or innovation with anything, generally people don't gravitate to it when they don't fully understand it. And sometimes that understanding can be as simple as, what exactly does it mean for me? Yes. Meaning that if I'm the biggest beneficiary of it, then I'm all for the change. But if I don't have a clear line of sight as to how it's going to work for me, I'm not quite sure I'm totally on board with that. And so, I think as a leader in this space, going into different organizations and and somewhat selling a vision on what this transformation could look like, this data transformation could look like, one of the key things you have to do is identify, obviously, key use cases, but you also have to identify what is kind of the benefit or the value proposition for each of these individuals or groups within that organization for them to really buy into it. Because if they're not bought into it, it's just not going to work. But I think, one of the big things too, you asked about benefits. It's been, what I've really been on, certainly the last several years, is this idea of convincing all organizations that every company is now a data organization, whether they want to be or not. You are a data organization first that happens to make cars, or you happen to make computers, or you happen to make whatever you make. You're still a data organization, whether you want to be or not. The question is, how good of it are you at it are you, right? And if you're, and you might as well be really good at it, because it will make or break your business. And I think that's the part that's a bit of a sobering reality for many of these leaders that are leading organizations now.
Yes, definitely, and we definitely want to see more people adopting that mindset, and creating the organizational and cultural change that comes as a result of being committed to being a data-driven company. Definitely the case. Sorry, I wanted to ask you with one of the things that I've heard a lot when companies are thinking about doing more research internally, more clinical research, is sometimes there's barriers. There's barriers around the creating treatment and control groups, especially in healthcare, and where that may mean that some people that could get a particular treatment don't get that treatment, so they can be a control group. Are there any sort of advice or any ways that you have used in the past that help address that, either get around it or directly look into how that can be done? Do you have any tips for organizations that are stuck at that point?
What a great question. You really did do your homework on this, didn't you? No, you're kind of hitting on, it's interesting, something that's probably one of the bigger ethical issues when it comes to this world of clinical research is around the idea that you have, in the case of, like, if you think about the pandemic that we're in right now, is that as you're developing therapies or vaccines for it, there may be a certain control group of people who would get historically a placebo, if you will, and there's questions around the ethical use of that for these patients who, if it's you or me in that control group, or it's our family members, we're thinking that they're actually getting treatment and they're not. And it's just kind of part of the clinical research approach that we've done with RCT since the beginning. But I think that what big data and what we refer to in pharma is external control arms or external control groups or historical control groups allows us to do is use to define patient populations based on that historical data set and use that in lieu of using an actual control group, if you will. And that means that you would define this population, this data set, based on the same inclusion and exclusion criteria that you would use for that clinical trial or that clinical study, and you would apply it to this historical data set, and then you compare those two data sets against one another. But that's certainly something that's becoming more and more prevalent in the world of certainly biopharmaceuticals and clinical research. And we think about, more effective ways to better utilize big data for a number of reasons. First, obviously, it addresses the ethical concerns, right? You want to talk about that. It certainly can accelerate the timeline that it would take to complete this sort of clinical study, because you spend a significant amount of time on the recruitment and retention of participants in these type of clinical studies. And then also, I think that, it's lower cost, right? You have the data's there. So you really kind of have this opportunity to really, to certainly think about things in a different way. That's a very practical use case, right? So as I'm talking to folks about the benefits of using that particular use case that you just described, that's easy for them to connect the dots and see. I think it comes in where I get in trouble because I go bold, right? I believe in going big or going home. I'm like, well, can we just think about the way we do clinical trials differently altogether? You know, just doing like a totally like big data trial, if you will, which is certainly a much more leveraging all digital and data technologies that we know, and it's much more virtual and decentralized. And honestly, right now, one of the concerns in the world of the pandemic, how do you continue with clinical trials when patients aren't able to go into any of these environments, right? To get seen. And so almost it's like the pandemic, if there was a silver lining, and there's not many, I think some of the biggest beneficiaries have to be the digital companies, because we're leveraging Zoom and all these technologies that we used casually before. Now they're the primary source at which we meet and conduct business. So I think that's the world as we know it will change.
Yes, definitely. And doing it for the benefit of people's health is a fantastic reason to adopt the change and bring in the new technologies. So on that front, are you sorry? I wanted to ask you about the new types of data sources that have been coming into your radar, say in the last few years, or anything that you can share. What type of data sources has you excited or has excited you recently? That brings data that can help either provide or get us closer to this vision of being able to do experiments or clinical research at scale, or that can give us ways of monitoring people's health in a better way, in a more proactive way. Anything like that are new types of data that have got you excited recently or at the moment?
Yeah, I mean, it's interesting because listening to your question, there's multiple parts to it. You said doing clinical research at scale. That's one certainly introduces one, kind of a host of data types that would be most suitable for that. But then you also talk about the world that most people are really kind of focused on, which is this whole world of personalized or precision medicine, which is all about getting that right drug to the right patient at the right time, which you and I could have the same clinical diagnosis, but what works for you could be different than what works for me, right? And I think so what that does is introduces this need to better understand what environment do you live in, what's your genetic makeup, what therapies have you been responsive to in the past in a favorable way, which ones do you have adverse reactions to? You start to understand all of these different things. And so that combines data that we know that we've captured about you over your lifetime in EHRs or the electronic health records. That comes understanding your family history better. That comes from understanding the environment in which you live, whether it be a lot of the social determinants that we hear about, whether it be the climate, pollution, whether it be you have power lines that are running right under your, who knows, right? A number of things. And then it comes from looking at genetic data or genomics. And better understanding that. And I think that what I find most exciting about that is just like this convergence of these different data types, where it's more like data fusion, if you will, that in a way that we've never seen it before, because we used to just analyze a single data type at a time, right? We essentially conformed that data to whatever data structure, that predetermined data structure we wanted. We made sure it was cleaned up as best we could, and then we would analyze it, right? Now we're saying, data is too unstructured, and I don't think we can get it to the point where it's a data structure is consistently applied throughout. And there are all these different data types, but yet we still need to get it to a point where we can analyze it and have some insights into the population. So I think, it's like a multivariate approach. And I think that where we are now and it is a very, very exciting, and you find yourself having to lean more on people who aren't as familiar with the industry, but they're experts in whatever technical disciplines they are, and partnering them with industry experts in order to do these types of studies and analysis.
Man, super exciting. Super exciting. This new world of healthcare, or as in like the transformation that it's going on, and that obviously that has been going on for quite a while, but now it's really heating up. What type of things are occupying your mind at the moment? What type of things are you either working on, obviously, that you can share, or what type of things are you looking forward to? What's exciting you at the moment? What's taking up that intellectual brain time?
I think I'm always thinking about the art of the possible, and I try not to get too far ahead of myself because, when you're too much of a futurist, people think you're a little insane, and they think you are also, sometimes they'll peg you as academic, they'll peg you as impractical, they'll peg you with all these different monikers, right, of why whatever you're doing doesn't work. And so I try to stay pretty balanced and taking this very future forward perspective, this very innovative approach with a certain level of pragmatism. And it's hard to really balance the two, right? Because I think in order to really strive towards anything, you have to think big picture, what can I do? And then you work backwards with some plan to get you there, right? And that's, to me, I don't see how you can do it any other way. But I've also learned too that if you sell a vision that's too bold to people who aren't ready to receive it, they're going to stop it on site and you won't get anywhere, right? And so if you have this bold vision, how do you pare it down in a way that people, and almost like digestible chunks, similar to what big tech does, right? So if I think that if Elon Musk came out and he said, I want to see, because he did say this, and he said, I want to see human life on Mars, right? And the few people who did hear it, they thought he was bonkers, right? But lo and behold, if you look at everything that he's done and he's put in place, what is he moving towards, right? And so it's almost like you almost have to disregard the bold vision and just really appreciate the incremental steps he's taken towards getting to what he ultimately wants to achieve, this interplanetary life that he describes, right? So I think for me, not quite being Elon Musk, but I do greatly admire this guy. And I think I'm trying to think about what does the world in data look like in a healthcare and a life sciences world next? How do we be bolder, and how do we learn from data real time to improve patient outcomes and the patient experience? How do we really accelerate the time that it takes to get a newly developed molecule and drug to patients much quicker, and it goes exactly to the right person at the right time, And so it's all about thinking about this cycle or the system, if you will, and how to connect it better with the foundation of it being data and how it moves through the system and how we make it available to the right people. And that, to me, is always the aspiration, going back to, what did I say? Information exchange with my mother, right? And so for me, it's always thinking about the system and how we move data through it and learn from it faster to where we don't have situations like you have with my mother and so many countless other folks who've had similar experiences.
Exactly. No, that is fantastic. And do you find that worldview and that vision is aligned? And I'm hesitating to see if I can make it a less tricky question, but because what I wanted to ask is how aligned is it to the responsibilities of your jobs over time? But maybe I should phrase them more as in like, are you able to take the steps that you want to take as part of your suite of responsibilities? Is there a space for this, and how does that compare to the rest of the responsibilities? Because you have, and for a long time you've had such big roles, and I will ask you a little bit about a contrast and compare between them. But first,
it's I think I got your question, and I agree. I think that sometimes the vision is so bold, it's bigger than the job, or it's bigger than the company at which you're working for to achieve it, right?
Mm-hmm.
But I think, though, if I think about the systems approach to how this ecosystem works, every actor has a role. And what I've learned is that I try to maximize the role of that actor in that broader system. So in the case of a pharma company, then the question is, okay, well, we care about research and development. We care about getting drugs approved and vaccines approved. We care about commercializing those drugs and making them available. And we care about learning from those things. So then, well, there's a lot to be done in that space. And then, you start to think about, well, is there a way we can disrupt how clinical trials work? Is there a way we can think about how we improve or incorporate patient experiences more into the paradigm than we've ever done before? So I think it does, so obviously I have this broad, bold vision, but I think there are certain more manageable initiatives that have to be done to achieve it, right? So, and so kind of going back to the Elon Musk example, and even how he launched Tesla, then SpaceX, and so on and so forth, he took much more of a systematic approach to how he's achieving what he's doing. And I think that it's no different for me. I think that, and so even when it comes to those particular use cases that I've identified, even within those, there are certain initiatives or projects that have to be done to ultimately achieve it. And it could be something as simple as you asked earlier, what are one of the key challenges? I think for us in the US, it's certainly been the lack of a national patient identifier. So we're trying to do everything around it, right? When the easiest thing to do is to establish a national patient identifier, then we can just create one longitudinal record for every citizen in the US, and then we can do all these really, really cool things. And obviously it doesn't mean that's the only challenge we have, but it's certainly one of the bigger ones, right? And so, so I think the more we can address these types of things, the better off we'll be.
I think that is a fantastic note to end on. Did you have any other sort of final thoughts that you want to share? Maybe around what would you like to see in the industry going forward? Is there anything that you think that the industry is lacking, or are there a particular, if you could make any change in the industry that would help the industry become better, what would be something that would be towards the top of your list?
I think what I would like to see are some of the key lessons we learned from the pandemic. I would like to see certainly much more global efforts to addressing global problems that we all face and share, working together in order to achieve that. I would like to see more cross-pollination of ideas and talent across different industries to address those problems. And I would like to see certainly us doing a better job of building that pipeline of talent. You asked me about the, being on faculty, and then, I view that honestly as an obligation, to really help mentor and shape the talent that's coming behind us, right? We're young now, we won't be young forever. I feel like I'm getting old already. But the question is who do you pass the torch to, right? As you are thinking about this whole thing, and we can go off and I can say I want to be the greatest leader, but I certainly hope someone comes behind me and say they want to be the greatest leader too, and they top every single thing that I've done. So I hope that's what I think we need, when I think about it. Those three things.
That's amazing, man.
Yeah.
Chris, you're an exceptional leader. You are an intellectual powerhouse, but I find that you don't lead with that. You lead with your heart. You lead with positivity, with a bold vision, and the impact that you're having on the industry is phenomenal. I want to thank you so much for your time. Thank you for sharing your story, your perspectives. It is immensely helpful for others, and I'm super grateful you did that with us today.
Great. Thank you. Thank you very much for having me, and I hope your audience enjoys this conversation, and they can certainly find me. I'm pretty easy to find, so happy to chat about anything.
that brings this episode to conclusion. Thank you so much for listening. Please find us on datafuturology.com or on Facebook, Twitter, LinkedIn, or Instagram as Data Futurology. Also go to datafuturology.com/podcast to find the show notes for this and any other episodes. If you like this episode, it would mean a lot to us if you could leave us a review wherever you listen to our podcast. I hope you enjoyed this episode and that it was helpful and valuable for you. Thanks again, and see you next time.